You know, Minnesota was the first state in the nation that authorized dental therapy for the entire population rather than just a specific element of the population as they did in Alaska. So we're proud of that. And since that, many other states have fallen in the same light and have been able to authorize dental therapy for their populations and in their state as well. And I see that going forward, I would expect it to exponentially grow, just as it did with hygiene, just as it did in medicine with physician's assistants and nurse practitioners. I would expect that that would happen as well with dental therapy across the country as more and more states realize how this new team member can actually help them deliver care, especially to an at-risk population at a lower cost.
Well, and I think nationally, I believe there are 13 states now that have passed some kind of legislation related to dental therapy. So surely it's on a curve to grow. I'm a little maybe surprised, and maybe not disappointed, but surprised that the attitude of, I don't even want to speak to organized dentistry, of some dentists in organized dentistry is still guarding the ability of the dentist to be the sole decision maker in care, and hasn't moved as quickly as I would have liked to having well-trained dental therapists or other oral health care practitioners who are able to practice under more indirect supervision than they are.
I hope in the next 10 years that dental therapy is expanding ideally to all the states. I hope at some point in the future dental therapists are able to really expand their scope as far as possibly specializing in pediatrics or geriatrics and really looking into those different areas. I feel that we have restorative and preventive skills that could be utilized in so many different ways, and so I just hope that we keep expanding and able to provide more care to more patients.
If a state is looking to add dental therapy, it's really a matter of understanding the needs of the state, understanding the oral health needs, although that's almost every state has tremendous oral health needs, so that's pretty easy to find out, but building the coalitions, right? Building your partnership, partners with building that legislation and putting forward, but also reaching out to existing programs and existing legislators and, to understand that. Because really that's what made it happen here, was the partnerships. And outside of oral health, right? The partnerships with nurse practitioners and with, just various medical people understanding, seeing their patients not being able to be helped.
Pediatricians.
Yes, thank you, right. Those were really impactful people to have on the oral health side, to help out.